Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today in the show, we have Sheetal Gambhir. She is a geriatrician. Her KevinMD article is titled Geriatric Foot Care, How Shoes Can Help Reduce the Risk of Falls. Sheetal, welcome to the show.
Thank you so much, Kevin. Truly, thank you for having me.
Sure. So we'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
All right. Well, I was born and raised in India, Delhi, and I moved to the US 5 years ago, essentially to train in internal medicine. And I then followed it up with a fellowship in geriatrics. I finished that last year, had a bit of a sabbatical, learned how to play pickleball, started writing a book, and now I'm a fresh, starting out as a PCP in Atlanta.
Excellent. So we were talking offline, and I understand you just started 3 to 4 weeks ago. So what have your first impressions been of being a new attending primary care physician?
There is a lot of billing and coding. So I'm working in a value-based model, and that's been pretty interesting, learning how that's so different from fee-for-service model. So that's been interesting.
Now, when you were training, did you get any classes or any training when it comes to billing and coding?
Absolutely not.
No, so kind of
Absolutely not.
learn on the fly. They just kind of tell you just to go ahead and do it.
Yeah, pretty much.
Now, you are a geriatrician, and we read a lot of times that we do not have enough geriatric specialists. So tell us, what are some of the reasons why you chose geriatrics?
So it kind of happened by chance. During the COVID pandemic, I was in second year of my residency. And the way it worked out, our leadership decided that everyone just stays put wherever they are. And I was working in the geriatric ward at that time. And I was there for, I think, 2 or 3 months. And that's how I fell in love with it. It was pretty awesome because that was a population that was pretty hard hit with COVID at that time. So we got to see how vulnerable they were. And also it was pretty amazing seeing how geriatricians worked, which is very different from the way I think medicine doctors or internists work. So that was very interesting to see. And that's how I knew, okay, this is what I really want to be doing.
Yeah, so you said that you saw geriatricians work for the first time during COVID, and you said it was a little bit different from how family physicians and internal medicine doctors work. So give us an example. How do geriatricians, how do they work a little bit differently?
I think one of the things that I noticed that geriatricians care about is mobility. They care about whether, I never thought about this as a resident in other wards, is how many times the patient is working with PT. So many times you'll see PT notes and they're like, oh, we came and the patient was busy with some procedure, something we'll see. So geriatricians get worked up about this. They're like, no. We're going to make you walk. Even if there's no physical therapist available, we're going to find you one or we're going to do it ourselves. And that shift in mindset, that mobility is so important. We study about it, we talk about it, and then we just leave it to the nurses or we leave it to physical therapists and we think we're done. Our job is to interpret results or think of medicines and think of how to get patient out of the hospital, but we're not thinking about mobility. We're not thinking about incontinence and why is that important to the patient or the family. So thinking about those things was so different and refreshing.
So for those who don't often work with the geriatric population, why is mobility? Why is that so important?
Mobility can really make or break your patient. So the way we were taught was even laying in bed for a day can lead to 1 to 3% muscle loss. That means more nursing home admissions. So that's increasing healthcare costs. And then there's something when we don't exercise and we're not using our muscles, things go down. There's more morbidity, there's more mortality. So what we really want to focus on is keeping our patients functional as much as possible. So even though we know this and, in residency we were taught, nobody really implements it, which is the sad part.
So as you know, I'm an internal medicine physician myself. I do primary care. Now, let's say I'm in a room with a Medicare, with a geriatric patient. I wanted to ask them some questions to assess their mobility. What kind of questions should I be asking them?
Oh, that's a good one. So what I do, I ask them, describe me your typical day. That's how I mostly see my patients, and that once I'm trying to get to know them, I ask them to do that. And that will just give you everything you need. You will realize the level of function they have. They're waking up. Are they taking care of others? Do they have stairs? Are they able to do certain things, or they're waiting on people to help them out? And that will tell you so much about their level of mobility. And the second thing is, more than asking, you make them do. So you ask them to just get up and walk. And just that simple thing, you'll see that so many patients will grab onto the handlebars and push themselves off. Just that little thing will tell me that this person has weak quads and they need to be exercising that. So there's these small clues that you can use to guide, where this, in the hierarchy of problems, where this patient's mobility should be.
All right. And speaking of mobility, we're going to talk about foot care, which is essential to that. Your KevinMD article is titled Geriatric Foot Care 101, How Shoes Can Help Reduce the Risk of Falls. Now, how did your article come together?
So I'm actually working on a book right now, and the book is for medical people as well as laymen, patients themselves, and each chapter is a geriatric syndrome. So it kind of explains their anecdotes, but the idea is to help explain geriatric syndromes to people as well as clinicians and what we can do about it. And it focuses a lot on non-medicine ways of dealing with problems. So this article is a little excerpt from that book.
Okay.
And why I care about this is, falls is the bane of every geriatrician's existence. Yeah. We hate falls. And the reason is, they can kill, obviously. So, head bleeds, or patients who have hip fractures, that's very common. So there's a mortality of 40% associated with hip fractures within a year. 40% of those, so 40 out of 100 people will die from one cause or another. So that's why it's important. And even if they survive the fall, there's a lot of morbidity. There's so many patients who were functional and mobile, and then they had a nasty fall, and then they get bedridden or they become nursing home residents. So it's important to talk about falls. And the other thing I realized during my training was, even though we're thinking, when we were taught about falls, there was a lot of emphasis on, okay, yeah, let's get their medicine right, or, some of us would prescribe physical therapy, and that would be the end of it. You kind of be like, I don't know what else I can do. Falls is just a natural part of aging. And I want to change that mindset that no, it can be worked on. Not all falls can be prevented, but definitely a lot of falls can be prevented. And there are different ways of doing it. And nobody during my residency taught me about shoes. It was only when I did my geriatric fellowship did we start talking about, what kind of shoes is the patient wearing? Or even taking a look at the feet and the shoes of the patient became like a very important part of my assessment as a geriatrician. So as a result, I was like, okay, I need to tell this to the world. This is important. And you don't need a doctor to get the right pair of shoes for yourself or for your loved one.
Yeah. So tell me more, because I certainly don't always ask about footwear and shoes. So tell us, why are shoes so important?
Okay, so what we do know, my article kind of outlines things we know about footwear and falls, and then what we don't know. So what we do know is that there is an association. So people who walk barefoot, so that's very common in elderly population to walk bare feet. And the reason is they might have a lot of, either crooked toes, hammer toes, corns, ulcers, things like that, and make it harder for them to wear shoes or slippers. And when they're walking barefoot, they're 11 times more likely to fall compared to when they're wearing shoes. So that's one thing we know. The other thing we know is, I don't know if you've had this, Kevin, in your clinic, but I have, in this southern part of the country, you see women being very proper. So they'll, wear lipstick, and they'll wear heels. Even at the age of 70, they'll have small heels, or when they're going for church, because they want to look proper. But higher heels, wearing heels that are more than 2.5 centimeters, have been associated with falls. And I don't know how researchers gauged this part, which is the surface area of the shoe. If you do not have a broad-based shoe, and if it's narrow, then you're more likely to fall. I have no idea in real life, how does one measure the surface area of a shoe? It does this looks fine and this doesn't look fine, you know? So we know that people, and then the other thing that different studies have noted is that people are not wearing the right kind of shoe. There's
Mm.
physical therapists often notice, especially when patients are going for subacute rehab and things like that they are either wearing shoes that are too big for them or too narrow.
Okay.
And that can cause a lot of problems and are also associated with falls. So we know that shoes and falls have a link, right? And we also know, this was something which was very interesting that I found out, and I didn't think, this was kind of counterintuitive, because the more comfortable soft-soled shoes are actually associated with higher risk of falls.
Huh. All right.
So, when my mother-in-law, we were buying her shoes, we wanted her to have the best shoes where she would feel comfortable, but then she also falls a lot. And I was like, oh God, but this is going to make her fall more. And the firmer, harder soled shoes are actually better. So it didn't make sense, but that's how it is.
Yeah, you're right. That is so counterintuitive. I see always those advertisements, like you're walking on a yoga mat, you're walking on clouds, those super soft shoes that I see often advertised. So you're saying those actually are associated with an increased risk of falls?
Yes. And the problem that I find as a geriatrician, so the fitting we can work on, and if they're walking barefoot, we can tell them to wear proper shoes. But the other thing that the article kind of focuses on is that there's dearth of research. Like, I want to be able to prescribe shoes. That's my dream as a geriatrician.
Yeah.
I want to write on a prescription pad one pair of Nike, whatever, XC 540 for falls, and prescribe them. And they go to a Nike store and then maybe pay a copay and get the shoes that they need to prevent falls. That would be the dream. And that's only going to be possible if we have randomized control trials of good quality data looking at commercial shoes that are already available, and how, what is the risk of falls with those shoes? Are we reducing? Are certain shoes worse off than others that we should be telling our patients, like, please don't buy these? That is where I think this could be helpful. This article could be helpful.
So when you're advising the geriatric population to look for shoes, and they go to either some type of sports store or they go to a shoe store, what kind of specific shoes are you asking them to look for? You did mention something about hard soles. So any specific type of shoe, like loafers versus running shoes versus different type of walking shoes, what should they be looking for at the store?
I think that's the hard part. I don't know how to give that practical advice myself, because I can share with them what I shared. So some of the practical things that I think of is, like, when I'm assessing my patients to try and see if they can take their shoes off. So if they are having a hard time even bending down and taking off their socks, I know they're not going to wear shoes with laces. So I usually don't recommend that it's fine to wear something, loafers or something that does not have laces with them, so it's easier for them. The second thing that I would kind of tell them is, the running shoes or the other shoes usually are made in a way which are specifically for that. So I don't ask them to get running shoes or tennis shoes. Those are very differently made for that purpose, for that movement. Lifestyle or walking shoes are fine. But yeah, I do tell them that they need to work on getting firmer soles. So if it feels too comfortable, then maybe not. Try something a little firmer. But this is the other pushback that I get. So arthritis is obviously very common in my population. And if there's a shoe that's going to make their arches or ankle hurt, they're not going to wear it. Mm-hmm. They'll probably walk barefoot. And that's where the challenge is. What is the right shoe? And I don't know, Kevin. That's the short answer.
Now, when you recommend a type of shoes to your patients, do you often get some type of pushback? Do they sometimes say, I love my walking shoe, it's super soft soled, and I don't want to switch? So what kind of response do you get from patients when you make some of these recommendations to them?
I think a lot of the time the shoe recommendation, like, obviously sometimes I do get a pushback, and it's not always the patient population that I'll also be working with don't always have the means or the resources. Shoes can cost upwards of $100. So if they don't feel the need to replace, they're not going to go ahead and specially buy. But then you do have people who are very anxious about falls. So you'll have people who just stop walking or doing their regular activities because they almost fell or they have fallen. So those kind of people are more open to the idea of, oh, if I wear this shoe, maybe, I'll feel a lot better. So that population I can get to fairly easily. Then the other thing is it's easier convincing people who are barefoot to wear shoes. So you kind of get a mixed bag. Some people are obviously going to be more motivated than others, but it's also what I found helpful is that it's much easier to convince them to wear better shoes than to take a new tablet. So if you tell them that, hey, this is at least better than being on more medicine or having, to worry about X, Y, Z, then sometimes that works.
Now, what's the role of podiatry? When should you consider involving a podiatrist when it comes to choosing the right foot care for your patients?
So one is, if you examine your patient's feet, that will give you a lot of information. I think something we commonly do is for diabetics, right? If they have bad neuropathy or they have Charcot's deformity and things like that, we do use a podiatrist. The other times when I use it is if I see, this is very common, like hammer toe, right? You see that protrusion, and then if it starts bothering them, if it's hurting, or it's started to limit their activities, that is when I will think about involving podiatry. And the good part, the other thing, which I feel like no matter what I think, the important thing is also to know whether insurance is going to pay for podiatry or not. So a lot of the times the framework is limited by not medical knowledge or the indication, but actually the insurance, which is a challenge.
We're talking to Sheetal Gambhir. She is a geriatrician. Her KevinMD article is titled Geriatric Foot Care 101, How Shoes Can Help Reduce the Risk of Falls. Sheetal, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Okay, so I think some things I want people to take away is falls are an important thing to think about. They kill, they can leave patients disabled, and they cost a lot. So preventing falls is important. There's a link between footwear and falls. Certain footwear are associated with higher risk of falls, so bad fitting, either too big, too loose, or high-heeled footwear and soft, cushiony footwear, they're all associated with higher risk of falls. And the third thing is that there is a dearth of research in this field. And if we just get enough research and without spending a lot of money, I think we can make a meaningful change in the risk of falls for our patients.
Well, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you so much.